So in Japan, there's a really interesting line of debate still going on, about the number of testing for the coronavirus infection. I personally think that the Japanese government is not doing enough testing, in order to grasp the situation and in order to adapt to the changing, you know, emergency. We really need to test more patients, potential patients. Otherwise, we wouldn't be able to know how many people are infected and where the cluster of people being infected by the coronavirus is occurring. So I personally think that, and my view I think is shared by many other Japanese people, that the current number of testing for potential coronavirus patients is not enough. So I don't believe the publicly published figures for coronavirus infection, because I think it is underrepresenting the real situation. So it's an enigma for me why the government and the medical professions not doing more testing, and why they're not striving to bring more ready and available methods of testing to the Japanese population. However, it's a really strange situation, but in the Japanese media, especially in the social network services, they're having arguments that testing more patients would lead to the collapse of the medical system. Some people argue that in order to test, you would have to go to the hospital, and that increases risk of infection between people coming to the hospitals, because it's a cluster of people and concentrated in a small space. So the argument is that by conducting more testing, more people would be actually exposed to the coronavirus, so that they would end up being infected by that. But that's a rather strange argument for me, because you could have alternative ways of testing for coronaviruses. For example, the drive-through or walk-through testing facilities set up in many countries, including Korea, and I understand in the USA too. In these cases, testing can be conducted without going to a hospital or medical facilities, and it doesn't have to involve people gathering in a small space, so that exposing themselves to the risk of infection. So it's an enigma really why the Japanese government isn't taking that particular policy of expanding testing capabilities. Another really particular culture I think I find in Japan is that testing is perhaps considered to be a sole of capacity for medical doctors. Now, in Japan, although I do not agree with this culture personally, there's this strong culture of separating what the medical doctors can do and what the paramedics can do. So there are certain things that only medical doctors, qualified medical doctors, can do, and the nurses and the paramedics on ambulances, for example, these people are not allowed to do certain things, and there's a really strict border between what the medical doctors can do and what the paramedics can do. And based on the reports being circulated in Japanese newspapers and Japanese television stations, it appears that the testing of coronavirus can be done only by recommendation of a medical doctor. Now, of course, I have all my respect for the qualified medical doctors. However, at the end of the day, the symptoms of the coronavirus are quite straightforward. It's described in many scientific literatures, and also it is very openly available to the general public on the web and so on. So that, even if you don't involve a medical doctor in bringing out a diagnosis, we can make a fairly good judgment of the likelihood of a person infected with coronavirus. So it's really strange that the Japanese government is taking this policy of testing only those patients who are judged by some medical doctors to be potential patients. Because, we don't have to ask the medical doctors really. And honestly speaking, it's not like only medical doctors have this knowledge and the general public do not have that knowledge. It's not like that. It's a spectrum. It's a continuum. Of course, the medical doctors are better qualified to do the diagnosis, but in order to do testing on the mass scale, like tens of thousands of potential patients, you really need to bypass the medical doctors. We don't really have to ask the medical doctors to do this testing. Otherwise, of course, there will be, an overload on the medical system. But that's because we are allowing only testing to go through, the medical doctors, and we're not allowing other people, paramedics, and other people who have the sufficient information to judge whether this person is a potential patient. And if we broaden the base for medical coronavirus testing, then we can probably probably expand the number of testing drastically. And I think that is what is happening in other countries. So, it's such an enigma. It's such a series of really hard to understand incapability of the Japanese government and the medical professions as a system overseen by the Ministry of Health, Welfare and Labor. It is this culture of almost bureaucratic, putting something in a box and not letting that out of the box, even if situations change. That is the particular culture of the Japanese nation. Although it, as somebody who has been born and brought up in this country, I can testify that there are many good things about the Japanese culture. This particular attitude of naming something and not really thinking out of the box beyond that naming and labeling and prototyping and so on. This could be a really serious problem with the Japanese system. And in this particular outbreak of coronaviruses, I think the Japanese culture is backfiring in a big way. So I do hope the Japanese government would change their attitude and allow testing on the mass scale without going through the diagnosis of medical doctors, because they have other important things to attend to. So let's do mass testing of coronavirus without involving the medical doctors, because we can do that, because it's not a big deal really to kind of judge whether this person is a potential patient of coronavirus infection. It's not a big deal. So let's do mass testing. That's my proposal.